Texas U.S. Representative Michael Burgess visited Puerto Rico a week ago today and joins us this morning. Thank you for being here, first of all.
Thanks for having me on.
You're in a unique position because as a doctor and also as a lawmaker, you're able to probably see things a little differently than we do. And you got to go in, and we'll show some of the photos, into the hospitals, talk with some doctors, talk with some nurses. What did you see in Puerto Rico?
Well, first off, let me just say that every time there is some type of major event like this, I try to go visit the hospitals, because visiting the hospitals, I've found kind of gives me a good look at how the community is recovering.
Okay.
So Herman Hospital earlier this month, Charity Hospital down in New Orleans after Katrina, Bellevue Hospital up in New York after Sandy, and this is something that I've just tried to incorporate as part of my work as a legislator with helping these places recover.
How did Puerto Rico fare compared to the other hurricanes?
Well, they were all bad, but Puerto Rico's in a unique situation because, number one, things were kind of sketchy before the storm hit. From the poverty on the island, just the infrastructure standpoint, things were already behind the curve. And, you know, one of the things that I'd actually been working on before the storm hit was how to improve the reimbursement rates for Medicare and Medicaid on the island. They have some unique things that are just unique to Puerto Rico.
Okay.
And I tried to correct those things earlier.
I know there are people in these hospitals right now. They're on life-saving machines. They're on ventilators. They're on dialysis equipment. Those are being powered right now by generators. I mean, generators, that's not a long-term fix. And the governor is saying it could be December before they have power.
Right. And of course, in the city of San Juan itself, they're getting power up much more quickly. So the major hospitals there, it is the hospitals around in the periphery of the country, which is why the Navy ship Comfort was going around the island and helping move patients who were in critical situations out of those facilities. But you're correct, the generators were never meant, they were meant for a short term, a few hours solution.
Right.
And they've been having to run continuously.
Yeah.
You do worry about maintenance in those situations.
Senator Richard Blumenthal from Connecticut, he was in Puerto Rico recently as well. He's this morning is calling for an immediate investigation into how the Trump administration handled Puerto Rico, how quick the response time was, what has been done since then. Was there a delay? Do you think we should have been there sooner? Are we doing enough right now?
You know, there'll be plenty of time for people to second guess things in the future. Right now, it's all hands on deck for their recovery. The needs are so great. Water, electricity, health care, not to mention the fact that no traffic light works in the city of San Juan.
Right.
So the traffic jams, as you can just imagine, are significant. Plenty of time for looking back later. Right now, it's still a recovery mode.
All right, let's talk about something that we're dealing with here in the U.S., and that's health care. President Trump's executive order, the president saying that he wants to scrap the subsidies to health insurance companies that help pay out-of-pocket costs for low-income people. Will this work? Will Republicans get on board? Democrats now are trying to make sure this doesn't happen. What do you want to see happen? What do you think will happen?
I think, first off, I think what the president did was provide a catalyst. You know, look, I've been working on this literally all year long within the House of Representatives, and it has been painful to see that you just keep getting stuck in the middle over in the Senate. So I think this does have the ability to move things along. And look, the subsidies are still going to go to the people who need the help. The issue is, are the insurance companies going to receive the reimbursement that they come to depend upon?
Aren't they going to pass that on to us?
Well, many of them have already built that in. And the whole structure of the cost-sharing reductions, perhaps that structure was wrong in the beginning, which is true of so many things of Obamacare.
All right. Thank you so much for joining.